I had to quickly come home and make this video because I just learned and better understood this technique to improve the range of motion and movement, especially after a stroke. May adlaw na tong tanan. I'm Nathan, I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. Because I was so excited about what I learned about these techniques, I immediately applied this with a patient. And let's call this patient Julie. Julie had a stroke a year ago, and she is very concerned that she's not going to have any more improvement. She won't be able to move her arm anymore because it has been more than a year. And somebody told her that the golden period of stroke recovery is just 6 months. But since I attended this seminar, this PNF seminar, or Proprioceptive Neuromuscular Facilitation Technique, I immediately applied this to Julie, and she presented with a tight elbow. Her elbow is like this, her arm is like this. It is hard to extend or to straighten out her arm. It is very spastic. So what I did was apply those techniques, and those techniques is just a contract, relax, or contract and stretch. So I told her to move towards flexion where it is spastic, so this way. I told her to resist or try to move against my hand, so the arm is towards this direction and my hand is the opposite direction, so away. So I told her to push against it for about 6 counts, and then I stretch her arm. I told her to relax first, and then I stretch her arm up to where it is tight again. So this technique, this proprioceptive neuromuscular facilitation technique, I know that's a mouthful, involves stretching and contraction and holding that position. So it improves the range of motion because it involves stretching. It improves strength because it involves contraction. It also improves the brain and body connection, or your ability to control your movements, because you are going towards certain movements that is being instructed by your therapist. So let me explain again what I did. So again, her arm is bent like this, all right? It is so hard to stretch, to make it straight. So I told her to flex your arm some more, or her arm some more. I resisted that movement for about 6 counts. And then I told her to relax, and then I stretch her arm like that. All right? Now, where it is tight again, I held her arm, resisted her arm, and instructed her to again bend her elbow. So the biceps or the elbow flexion is where it is tight. I told her to resist that movement, move that arm towards flexion, and then I stretch her arm some more after 6 counts. And again, where it stops, where it's tight again, I resisted her movement for about 6 counts, and then 15 counts of stretching, or 15 seconds of stretching, very slow stretching. Again, do not force that stretch because it will rebound and will make it worse. But try to do this exercise or this technique after you have done your exercises, your strengthening exercises, because you don't want the ability of the muscle to go stronger. What you are making stronger, the area where you're making it stronger, is your triceps when you want it to straighten out. Now, if you do this method before that, you will lose a little bit of ability to strengthen that muscle. So do this exercise after you have done your strengthening phase, and then you do the stretches right after. Now, do not force past the tolerance of pain. When you see that, or when you feel that your patient, or you are, if you are the patient, if that area is already painful to stretch, stop there. Now try again a little bit later. try to do this multiple times during the day. Now, I'm also going to do the attendance check. The attendance check, just type it down below, is unwind. You just want to make sure that everybody's following along, especially those who have stroke or those who have stroke patients and they're helping them out. Please share this to your family and friends, especially those who have stroke. Their stroke has been more than 6 months, multiple years. Do not give up because there is still hope. Try to apply these techniques. And if you have any questions, suggestions, or comments, just type it down below in the comment section. I'll try my best to answer all those. And just a reminder, consistency is the key and never give up. Until next time, paalam!